So I'm going to talk about increasing adolescent sexual health care services in primary care. Oh, I need my clicker. And also, I'm from New York, so I'm a fast talker, just like Dave. Even so, if you if I need to slow down, let me know. So when I like to think about healthcare challenges and opportunities, kind of dissect it, because they're very complicated issues. So I like to think about them at the health systems level, at the provider level, and at the patient level, which for adolescents are the adolescent patients and their parents. So we're going through this, just try to keep those in mind, because it's very, very complicated. So first, I'm going to talk about the challenges, and then I'll end on a good note with the opportunities. So first, just kind of a brief overview of the challenges. I mean, first of all, to provide sexual health care services in primary care, people need to be going into primary care. And many adolescents do not seek any primary preventive health care services. And it's not just because they're not going to the doctor, it's because many adolescents are uninsured or underinsured, and we know that that's a big barrier to receiving any type of health care services. Also, sexual health care services are very sensitive services, and many adolescents want them to be confidential. And it's a problem with confidentiality, especially when it comes to the billing issues. And then many providers just aren't offering those services. They might not feel comfortable just because they feel uncomfortable, performing an atraumatic parentectomy, getting the parent out of the room without having them be really angry with them. It's a surgical procedure sometimes, and then just getting having the training to do all this. So let's look at each of these issues. First, let's talk about adolescent preventive health care services. And it's really the challenges are not only with accessibility, but also with availability. So we know that adolescents and young adults are the group that are most likely to be uninsured, but also that's a big problem with underinsurance, too, that I think we don't talk about it as much. And adolescents and young adults, they're most likely of all kids to be underinsured also. And we know that kids who are underinsured, or anybody who's underinsured, is least likely to have a medical home. They're more likely to delay or even forego completely needed health care services, and they're also least likely to receive specialty type of health care services. So this is, I don't know if you can dim the lights a little bit so people can see this table, but this is data from a large study. It was a survey, it was a nationally representative sample of parents of adolescents, asking them about the healthcare services they've received in the last year. And you can see that most adolescents did not receive a preventive healthcare services in the past year, only about 40%. And this is, and then again, there's huge disparities in this. It's not everybody across the board. They're more likely not to have received a preventive health care visit if you're a minority, black, or Hispanics. I don't have a pointer here. Yeah, pointer here. If you're poor, and if you're uninsured or underinsured. So again, there's huge disparities, racial disparities, socioeconomic disparities. It's not even ground. And then of those adolescents who did receive a primary care visit, who do have health insurance, many of them don't go to preventive health care visits. So these are data that was taken from looking at billing data from a very large health plan in Minnesota. They have about 700,000 members, looking at health care services that adolescents between the ages of 13 and 18 received in this health plan over a 10-year span. And you can see that 30% had no preventive health care visits whatsoever, and 40% only had one preventive health care visits. And this table is looking at the average number of preventive health care visits and then the average number of non-preventive health care visits or acute care visits, sick visits. And you can see that kids are going to their health care provider. They're making lots of visits for sick visits, for cough or sore throat or sprained ankle or whatever, but they're not a lot of them are going for preventive health visits. Is really where we need to get into the down and the dirty with the sexual health issues and the mental health issues. You're not going to address that and the kid comes in complaining of a sore throat. Unless you're savvy and you ask if they're having oral sex. So let's talk about confidential, gonorrhea, throat infections hurt. So let's talk about adolescent confidential care. And again, the challenges are not only with accessibility, but also availability. So, again, at this in this survey of a large nationally representative sample of parents, asking those kids who did receive a preventive health care visit, they got over the insurance barrier and they got over, the barrier of actually actually making a visit, asking them what proportion had some time alone with their healthcare provider, with the provider was able to do an atraumatic parentectomy and have some time alone with the child. And only 40% of the adolescents said they had any private time with their healthcare provider. And you can imagine if mom or dad in the room are asking, "Are you having sex?" "Nope. Not a problem for me." Are you smoking weed? "Nope, never touched this stuff." I mean, they're not really going to be able to even ask those questions, or if they ask those questions, really receive any type of valid information. So, and those are issues that really need to be addressed. And again, there's a disparity with this. There are people who are more likely to have time alone with their healthcare provider than other people. And they found from the survey that kids who are females, younger teenagers, Hispanic, and the poorest adolescents are not having private time alone with their provider. And so this is a table actually breaking it down, looking at the proportion of kids who had a preventive health care visit that had time alone with their health care provider. So you can see here, kids that were Hispanic, poor kids, and kids that were uninsured and underinsured were less likely to have time alone with their healthcare provider, and so you can imagine those sensitive issues were not going to be addressed. And I know as a parent, I want to know everything that's going on with my kid, but it's really important that adolescents have some private time alone with their healthcare provider. First of all the national professional medical organizations recommend this. We all have policy statements: the American Academy of Pediatrics, the American College of Obstetric Gynecology, the Society for Adolescent Health and Medicine. We all firmly believe that adolescents should have time alone with their provider. And I mean, it's first of all, it's a developmental issue. I mean, kids need to start learning how to take responsibility for their health care. And so this is kind of like training. They're having their training wheels. So because mom's out in the waiting room, so if they really need them, they're there. But they have to learn how to talk about their health and ask the right questions and have a conversation with their health care provider, because a lot of times when they're 18 or 21, they're on their own. And then, there are many issues that really are important, and they really need to get referred into specific health care or receive, specific services that kids just don't feel comfortable talking about it in front of mom. I mean, remember when you were, 16, 17, 18, there are things you were doing and you didn't want your mom to know, and that's still going on today, and maybe even more. And so, if a teenager is sexually active, they need to be tested for STDs and HIV. And if someone is using substances, I mean, they need to understand that they really need to make smarter choices. Or depression or bullying, I mean, those are all really serious problems that needs to be addressed. And it's not going to be addressed many times if they don't have private time with their provider. So research also shows that adolescents are very concerned about confidentiality, and if an adolescent thinks that they're not going to be receiving confidential services, especially for sexual health care, studies show that they're just not going to go for care, but they're going to continue with their risky behavior, but they're just not going to go for care. And also, again, as I mentioned earlier, the provider is really not going to be able to have a valid dialogue with the adolescent about these health risk behaviors if the parent is in the room. So, and these health risk behaviors are really prevalent among adolescents. These are data from the last CDC Youth Risk Behavior Surveillance Survey, which is a survey of a nationally representative sample of high school students, asking them about health risk behavior. So these aren't out-of-school kids. These are kids in high school. And these are just the questions about sexual behaviors. And you can see that almost half of high school students have had sex at least once. So that's a lot. Many of them are not using condoms. Many of them are using drugs or alcohol around the time they're having sex, so they're probably not making wise choices. So this is a reality of our U.S. teenagers. So we really need to be able to address it medically. Fortunately, minors do have the right to consent for their own health care in every state. The laws vary a little bit by state, and so you should be, obviously you should be familiar with your own state laws, but adolescents have the right to consent for services either through their own legal status, or for any adolescent has the right to consent for certain specific health care services. So adolescents who are pregnant, or who are parents, or who are married, or are considered emancipated or mature, they can consent for all their own own healthcare services, not just sexual healthcare, but everything. But then any minor and then again, the laws vary by state, can consent specifically for STD testing and treatment, for HIV testing, for sexual assault care and reproductive health care like birth control, prenatal care, emergency care, and mental health care. So adolescents can consent in every state for healthcare services depending on their status and the service. And then, I think as adults we assume, if you consent for your own care, then it means it's confidential. But that's not true for adolescents. Consent does not equal confidentiality. Many states do have provisions that allow that the health information is restricted if an adolescent does consent for the services on their own, but that's not true in every state. And then when you go to the reimbursement issue, that's like totally, out the window. I mean, you can imagine that, if a health insurance receives a bill, they don't know if it's a confidential service. They don't know that the adolescent, consented for the service themselves. They just know that who the primary insured is and who to send the bill to, but they are not thinking of anything else. So, and there are these laws that provide minors the right to consent for their own care don't make any provisions about billing or waiving high costs of coinsurance or copayments. So, billing for confidential services, health insurance is very, very complex, and billing for confidential healthcare services is even more complex. I'm sure that through your own experience with health insurance that, once you receive, if you have commercial health insurance, once you receive a health service, you receive from your health plan an explanation of benefits. And that is a statement from your health plan saying, okay, we were billed for these services, and we're going to pay this amount. You have to pay this amount, and your healthcare provider has to eat these costs. So, commercial health insurances really send this out for all, every services that they're billed for, regardless of, what it is. And they send this to the primary insured. Well, the problem is that the primary insured is usually the parent, and so they're going to get this notice from their insurance company that their child, no matter how old, had this medical service and these tests. And I think many health plans are just for trying to be more discreet about what they put on the explanation of benefits, and maybe they might make the the language that relates to the code very nondescript. But still, if a parent will know, like, hey, you went to the doctor. What did you go to the doctor for? I didn't know you went. And hey, you had this test that cost $300. What was it? So, I mean, that, it's still going to raise red flags. And, there are no kind of laws that allow health plans to suppress certain EOBs and not suppress others. There is a loophole, though, that I think most health plans don't use. And if a service is fully covered, or else if there's just a copayment involved, then by the primary insured, then the health plan does not need to send an explanation of benefits. So if the health plan is fully covering the service, the primary beneficiary doesn't need to know about it specifically because they're not really paying any money out of pocket. However, the way everything is programmed by the insurance companies in terms of billing is everything automatically gets sent out as an EOB, no exceptions. So I don't want to give anybody post-traumatic stress disorder from a bad insurance bill, but this is an example of what an explanation of benefits may look like. So it says who the claims are for what specific person, and then it talks about what the service is, and then what the health plan is going to pay, and then what the primary beneficiary is responsible for. So everybody with commercial health insurance gets these statements. So again, let me move on to providers' STD screening practices. So these are data from the National Center for Quality Assurance, their quality assurance data called HEDIS, the Healthcare Effectiveness Data Information Set. And this is looking at the proportion of sexually active females between the ages of 15 and 24 who had a chlamydia test in the prior year. And so you can see Well, there's good news, bad news. The good news is, the rates are increasing every year. They're doing a little bit, healthcare providers are doing a little bit better about screening sexually active young adolescents who are most at risk for STDs, as you saw with those data, for chlamydia each year. The bad news is that, we're still under 15% total. And with the, look at the slope of the rate of increase, if we continue at that same rate, it's going to be like 2050 or beyond before most adolescents are going to be screened, because it's a very it's almost flat. So we need to think about how we can help healthcare providers to do a better job. So I've told you a lot of bad news, a lot of challenges. Is this hopeless? No, there is hope. There's always something we can do. So this is a study. These are data from actually a survey that the American Academy of Pediatrics conducted recently of their members, asking them if they're interested in doing more, enhancing their adolescent preventive services. And you can see from the data that most pediatricians responded that they had some level of interest in doing a better job with adolescent preventive care, including STD care and GYN care. So I think the good news is I think providers want to do a better job. They just need a little bit of help. But there is help. We have this great national chlamydia coalition that can help us all, rally around this cause. Members include these medical professional organizations, a lot of, advocacy group, women's health groups, public health groups that are all have this common goal to improve the health of adolescents and young adults, especially females, by kind of nipping this chlamydia problem in the butt. So, and we even have a website, so that means we're real. And they have a site for healthcare providers specifically with all these resources to help them out. So, this is the homepage for the National Chlamydia Coalition Healthcare Provider site, and it has all these great resources on it. First of all, we have this huge toolbox, this array of all these resources for healthcare providers to help them do a better job with chlamydia screening. And we have educational materials for providers, CME, medical educational materials. We also have materials if healthcare providers want to train other healthcare providers, give lectures. There's our, lectures ready to go on there. There's patient education materials. There are clinical practice tools to make it easier for healthcare providers to do this stuff. And there's also resources to help them talk to policymakers like you about this important issue. Also, there's this great tool, how to screen for, it's called Why Screen for Chlamydia, but it's really, chlamydia screening for dummies or something, like those books that we used to have. And it's really a comprehensive guide. Everything you need to know about how to set up your office, the tests you need to do, the type of questions you need to ask, and it addresses what needs to happen from when the adolescent walks in the office until they leave, and even beyond, giving them their diagnoses and helping them get their partners treated. It even has like a little diagram of what needs to happen when starting from again when the adolescent walks in the office and talks to the receptionist in the waiting room, and then until the very end, if you may have to give some bad news over the phone about a positive chlamydia test and help them, negotiate and tell their partners to get treated so they won't get just reinfected right away, which David's going to talk a little bit more about. But it's just really a great resource. Also, many of the medical professional organizations have jumped on the bandwagon to help, their members do a better job providing adolescent preventive health care services, of which sexual health care services are a big part of. So this is looking at the website at the American Academy of Pediatrics. They're looking at their Bright Futures website, and Bright Futures is now the standard of care, the guidelines for comprehensive pediatric and adolescent health care in the United States. And so everybody's on board with this. And so all the materials are out there. They have tools, they have guidance, and it includes how to do this type of preventive health care for adolescents. They have a whole section on adolescent health care, and that's available to anybody. And also the ACOG, the American College of Obstetrics and Gynecology, they also have a specific resource and toolkit for OBGYNs to provide this comprehensive sexual health care to adolescents. So I think the professional medical organizations are on board with this. And also the government is on board too. As you saw earlier, there's a set of of preventive services that are evidence-based, that the U.S. Preventive Services Task Force and the Advisory Committee on Immunization Practices recommend that all adolescents should receive to stay in good health. And these are going to be, with the healthcare reform, we're anticipating that these will all be 100% covered services. And so theoretically, if all adolescents eventually are insured and these are 100% covered, it'll be easier for adolescents to receive. It'll reduce some of the barriers, but not all the barriers. But we really need help from our legislators to get this work done. And so I have my wish list up here. First, it's going to take a little while for everybody to be 100% insured. So until that happens, we really need help to getting Medicaid expanded. So these adolescents who are uninsured and underinsured will have health insurance, and they'll be able to get the care that they need. That will not be a barrier. And also, we have these Title X family planning clinics. Also, making sure that they have the support that they need so they can provide the STD screening and treatment services. Also, helping us to expand our kids to get more access to these services. Helping healthcare providers do the right thing. Really unique examples. I'm from New York. New York State this fall they had an application, a grant application for an organization to take on training all healthcare providers in New York State to offer comprehensive sexual health care services. So we'll see how that plays out. But I mean, again, the state is taking the lead to try to get healthcare providers trained. So in New York State, so that will not be a barrier. Also, working with health departments to help them address the special health care needs of high-risk communities. Again, there's huge disparities in STD rates. There's huge disparities of people, teenagers accessing care. So, work with the health departments to see, how we can help address this situation. And also, talk to your professional medical organizations. I mean, we're in the trenches seeing these kids. We know what's going on. For example, I work in our children's hospital adolescent clinic, but I also work in our school-based health centers. So, I hear what's going on in the schools. Talk to us. We'd love to give you some input. See what we need to do in our community. To meet the needs of our adolescents. So, just as a final thought, we all share a common goal. We all want the adolescents in our states and our communities to be well, and that includes being in good sexual health. So let's think about, how we can work together to get this done. So thank you.